So welcome to this presentation about medicine at Newcastle University. My name is Claire Gilding. I'm Head of Admissions and Recruitment. Firstly, I'd like to talk to you about our course structure. We have got two programmes here at Newcastle. We have got our A100 5-year programme, and this is where the majority of our students, around 245 a year, come on to. And we've also got an A101 accelerated degree programme that takes in about 25 students a year. Now, for those first 2 years doing the A100 5-year programme, and for that extended first year of the graduate entry programme, you would be studying a course called Essentials of Medical Practice. And this is campus-based at Newcastle University. Then, when you move on to years 3, 4 and 5, which have each got different clinically specialised focuses, you will be based in clinical sites around our regional medical school. And I'll say a little bit more about the regional medical school in a few minutes. But firstly, thinking about our campus-based teaching in years 1 and 2. So we run a case-based integrated curriculum, and we run a series of 25 clinical cases over the first couple of years, each focusing centred around a patient with a particular condition or conditions. And each case lasts around 2 weeks. Some are a bit shorter, some are a bit longer. Now, the way this case-based teaching works is that rather than teaching our curriculum where we do a big block of biochemistry followed by a big block of genetics and a big block of pharmacology, all of the different academic skills, professional skills, clinical skills are all taught focused around those particular cases. So you can see we start with case 1, which is a hypertension case, move on to a cardiovascular disease case. So taking that cardiovascular disease case, within that case, you'll be learning things like the biochemistry, genetics, molecular biology related to cardiac function. You'll also be looking at the physiology of the cardiovascular system and the anatomy, and that will be done within our dissecting rooms. We would introduce you to some of the major diseases of the cardiovascular system, and we would look at different pharmacological, main ways of treating them. We would also be doing alongside that clinical skills around cardiovascular system. So you'd be starting to look at things like cardiovascular examination, cardiopulmonary resuscitation. But within the whole of that, we also look into things like ethics and professionalism. You might start to touch on things like do not resuscitate orders. So as you can see over the first 2 years, you get an overview of all of the major diseases and body systems. And at the end of year 2, we then have what's called a transition to clinically based learning block, where you will be doing some experiences and placements in the clinical hospital that you're going to be in year 3. So just noticing that alongside that, we've got some early clinical and community experience visits. And I'll say a little bit more about the early clinical and community experience visits and how we teach on years 1 to 2 in a few minutes. Thinking now about the regional medical schools. So in years 3, 4 and 5, you will be based within and in separate one for each of those years, primarily within a hospital and community NHS trust. You will also be allocated with a GP, allocated to a mental health trust, and obviously you've still got the university. I'll show you the locations of them in the next slide. This slide here, years 3, 4 and 5, just shows you the variety and the structure of different clinical placements that you will get over your time with us. So year 3 starts with Essentials of Clinical Practice, which is basically an in-hospital revision session of all the clinical skills you've learned in the years 1 and 2. And then if you just glance across it, you can see we cover medicine, acute care, surgery, placements in things like reproductive health, child and young person's health, mental health. You get GP placements throughout. In year 4, we've got a really innovative strand that runs through the curriculum, looking at clinical experiences in long-term conditions, and you'll have a number of patient panels who you follow through primary, secondary and tertiary care throughout the duration of the year. There's a number of times throughout the curriculum where you get to choose to study a particular area of medicine that is of interest to you. So you can see at the end of year 4, a couple of student-selected components. And in year 5, you will have an 8-week elective placement that you can do anywhere in the world you would like to go to study any part of medicine that you're interested in, as long as it's approved as a safe country by the Home Office. Where you'll be placed in years 3, 4 and 5 is around our regional medical school, and we have the privilege of working with 10 NHS trusts, and we also have around 300 general practices we work with around the region, and this gives our students a real diversity and breadth of experience that they wouldn't get if you were in a university that had a sort of more localised population of hospitals. So you can go from tertiary care settings, huge hospitals like the RVI, which the medical school is attached to in Newcastle city centre, to, for example, rural GP placement in Northumberland. Some of the key features of our course include, I'd already mentioned that it's a case-led curriculum, and some of those cases that you meet in years 1 and 2, you'll take through to the later years, but more complexity, multimorbidity, comorbidity will be added in to those clinical cases. We have initiated a programme this year which is called Learning Communities. This is really innovative in the UK. In this, you will be given a personal and professional development tutor who will stay with you for the 5 years of the programme, and you'll be put into a group of around 10 to 12 students, which is your learning community, and you'll stay with this learning community for the duration, and you will have a number of small group teaching sessions in that community, so communication skills and fortnightly meetings with your personal professional development tutor, where you'll cover curriculums looking at professional identity development, careers development, teamwork and critical thinking. We've always been really strong at Newcastle in our communication skills and our development of professional identity. So clinical and communication skills, you'll be starting from within the first weeks. In addition to your personal and professional development tutor, you will have an academic mentor, for each year of the programme. You will have regular scheduled meetings with them at the beginning of the year, at the end of semesters, and after every assessment or assignment result has been released. And you can have more as you want. And they can help you with things like study skills as well. We've got excellent student support, and I'll tell you a bit more about that later, and I'll tell you a bit more about student choice later and our online learning environment. So in terms of clinical skills, these are only a fraction of the clinical skills that you will do in the first few years. The first one we start with, which I think everybody understands now post-COVID, why we start with it, really important clinical skill is our first aid. Our hand washing. We do first aid training for all of our students, so if you were to encounter somebody in the street, you might know what to do better than if you haven't had that first aid training in the first year. We do examinations of all the different body systems, CPR, and one of the things I mentioned earlier was this early clinical and community experience visit. So you'll have 8 days in years 1 and 2, and each of these days is either with a GP or it's in a hospital. And when you're going for those placements, the people who are providing them know what you're doing in the curriculum at that time. So say you are doing a respiratory case, they will try to find you respiratory patients who you can take a history from or who you can examine. So it links up what you're doing in the classroom into real life clinical experience. In terms of the teaching methods we use, we're not a problem-based learning or a team-based learning or an interprofessional education curriculum, but we use all of those different teaching methodologies and more as part of the way that we teach. So we've always had a really strong emphasis on evidence-based, innovative and interactive teaching methodologies. What we do is we look at what your learning outcomes are and we think, what is the best way of delivering those learning outcomes to and with you? So we do some large group teaching, so whole course seminars, particularly when it's early in the subject and you're just starting to learn it. We do a lot of small group teaching. We also do interprofessional education with nurses and pharmacists, team-based learning, clinical skills right from the get-go. We have simulation suites and our dissecting rooms. So we use pro sections so cadaveric cross-sections for our anatomy teaching here at Newcastle. We also use combinations of those together. So this picture down here at the bottom is me teaching pharmacology to our second year students. I think I'm teaching anaphylaxis in this one. And we have SimMan, who's a virtual patient, a really powerful virtual patient. You can program them to have normal or abnormal physiology and behaviour. So you can program them to have normal heartbeats, or you could program them to have normal breathing, or they could have an asthma attack or a heart attack. And that SimMan will then respond appropriately to treatment, whether that's CPR or whether you're giving them a drug to treat that particular condition. So in this one here, I'm doing a role play with some of our clinical teaching fellows, and you can see on one side SimMan's vital signs, and what I am posing is a series of clinical questions about what should we do in this situation, and then if we come through to medication, what drug should we give? Okay, so what route should we give it? What dose? And essentially you as a student vote on whatever it is you want. Whatever you decide as a majority, we apply, and then you can get to see in real life physiologically what's happening. So, a whole range of innovative teaching methodologies. We have got a bespoke, so it's made for us, medical learning environment, and it was made by our in-house technology team. So rather than having a sort of off-the-shelf like Canvas, Moodle, Blackboard, we have something that's been designed entirely for and to fit the needs of the medicine degree programme. It's really fantastic. Everything that you need is there. It follows you throughout 5 years. So we record all lectures, some of the seminars. So if you, for example, in 5th year wanted to go back and listen to one of my first year lectures, you would be able to do so through this portal because it saves everything for you. This just gives you a snapshot of a week. This is February to March in this year. We can see on Monday the students were doing a volunteering day. On Tuesday, we've got some lectures. We have a virtual early clinical and community experience. So this is an additional one, which is live from a GP clinic. Some more lectures and some seminars. So then there's some first aid training later in the week, I see there. Again, we've got a to-do list, so it lets you know when you need to do things, and it just helps you keep track of the work that you have. In addition to the student selected components that I was talking about, and the elective component and the elective that I was talking about, we have got a campus over in Malaysia that runs the identical degree programme. We run the same cases, same curriculum. They do the same exams at the same time, but with the time difference. Start later in Malaysia. We start sort of 9:30 in the UK for the exams. And what that means is it's really easy actually for students to exchange campuses and experience living and working in another country and culture. So this is me with one of our groups of exchange students. The students do it currently for the first semester of year 2, those that want to go. And it's just a wonderful opportunity to see what, particularly for the early clinical and community experience visits, going into different hospitals, going to clinics in Malaysia and experiencing what healthcare is like in a different country is really eye-opening. We are a Russell Group institution, and so there is the option to do an intercalated master's between the 4th year and the 5th year of the programme. So basically you step out after you finish your 4th year, you do a master's, you get your master's, and then you would come back into 5th year. The way the funding options for that works is you would get NHS bursary funding for up to, at the moment, it's like 9,250, maybe 9,400 it will go up to soon. So that's a non-repayable bursary which can be used towards the payment for the master's year. And then you would get that NHS bursary again in year 5. So it's quite a good option for those who are looking to get that experience. Many of the students do masters in research. We've got many different, world edge, cutting edge laboratories at Newcastle, but you could do it in something different: global health, public health, medical education. Or we also, if you want to do something outside of our university nationally or even internationally, we allow you that opportunity too. In terms of the support that we offer, loads of different types of support. I've mentioned already the learning communities, and because you're staying with that community, and we do loads of work to begin with to build that team and bring that team together, with your PPD tutor. And because you're with them longitudinally, that's a real source of support for you through the programme. And as are the academic mentors. Each student, when you're in first year, will be given a peer mentor who is from second year. And then when you're in second year, you will be given a mentee from first year, and they run through longitudinally. We have a student wellbeing advisor who is specific for the medicine programme, so knows our students well, knows the programme well, and they link through to some of the university support services. We can provide study skills support, and as part of the learning communities, we've arranged it so some of your teaching sessions each year are joint with other years. So in years 1, you'll have some sessions with your year 2 community. We'll have the same PPD tutor. So 20 to 24 of you in those sessions. And as you go through, that will build up until you've got a community across all 5 years. So in terms of what we are looking for in medical students, in our selection process, obviously we do screening for and things like UCAT. We're looking at your results, like your A-level results. But in addition to those, which are looking at academic and type competencies, we're also interested in the things that we believe are really important for being a doctor. So what are your communication skills like? Do you have empathy and self-awareness? Do you have integrity? It's a long career, it's a vocational career. So do you have that motivation and commitment to be a doctor? I put compatibility, so that I mean, compatibility with our MBBS programme and the way that we teach and learn at Newcastle. And can you show signs of organisation and resilience that will help you on that programme? So in terms of interviews, we generally run interviews either as multiple mini interviews or as 2 personal panel interviews, dependent on the population of students and the time of the year. And whichever interview format you have, we will be assessing those key competencies that you see there. So we would ask you situational questions about your experiences and behaviours. There's no right or wrong answers. If we're thinking about teamwork, we might ask you to give an example of when you've been working in a team and it's worked well or it's worked badly. And what the selectors will do once you've given your answers is just go into a bit more detail. So they'll get you to reflect on that. Okay, so what have you learned from that? What might you do differently if you're in that situation again? And as I said, it complements the academic and the UCAT testing. So in terms of preparation for interviews, usually what I advise is just try to think of scenarios and situations where you can talk about, where you have shown empathy or self-awareness, or think about why it is that you might want to come to Newcastle, so you can talk around from your own experience those different competences. We've got an incredibly active student union, Newcastle University Student Union, otherwise known as NUSU. They run a whole different range of activities, sporting activities, volunteer activities, societies, things like that. So if you look through at the societies, and you can look at these web pages now, there's over 160 societies at the moment. And if there isn't a society that you're interested in, they are there to help you set that up. They have the support, they have the funding to help you do that. At the beginning of the year, there is a 6-week free trial for all of the course and school-related societies. So you can try out those societies for a period of time, and then after that, if you want to carry on with them, you'd have to pay the membership fee. But if not, you've tried out a range of things and found what fits you. In terms of our location, I think I've worked in a number of different universities across the country and have landed and stuck here because it is a wonderful place to live. It has got all the city centre, attractions you would get from a city, but it's also very easy to get out and about, up and down the country and around the country. So you can get to London on the train in about 3 hours. Edinburgh's actually an hour and a half on the train. You can get to beautiful beaches in about 15 minutes. This is one a few minutes from where I live here with the sunset, and then Northumberland as well, near the Northumberland National Park. And that's a picture from when we saw the Northern Lights here last year. So these are just more pictures of things you can see. I've left the sycamore, gap tree up. It was, very beautiful, very sad. But that whole part of Hadrian's Wall is amazing to visit. Obviously, we've got a variety of different sporting teams, but we have the football stadium is very close to the university and our campus. So it's a really vibrant city to live in, but also with a lot of amazing countryside around it, and a really lovely place to live. So finally, if you've got any questions about this, you can email through to our MBBS admissions email box, which is shown here. So send them through and they will be able to get back to you with any questions that you may have. And thank you so much for listening. And it would be absolutely wonderful to see some of you working and studying medicine with us soon.